Yeah, that's a great question. I think, from my perspective, I think a lot of that increase is really an increase in diagnosis, and that's attributed to an increase in public awareness, not only because there are new drugs coming down the pipeline and we're hearing about those medications, and people are coming out of the woodwork saying, hey, I think I might have this diagnosis and there's a drug for it, but also because industry sponsors and nonprofit organizations like the Hidradenitis Suppurativa Foundation have been trying to increase public awareness of HS so that patients know, one, that they might have a condition with a name, and two, that there are treatments for that condition. So I think increased public awareness, along with an increased willingness to seek medical care now that there are treatments available and more readily available, really are responsible for this increase in diagnosis that we're seeing. I think that's really what's driving those numbers. The study in question that you mentioned is really an association study and not a causal study. So it's hard to know what to make of that link. I think it's fair to say that there's limited data to support that HS is a consequence of metabolic disorders, and treatments used for metabolic disorders are not changing the course of HS. There's really limited data to support improved HS in the context of weight reduction, for example. And I'll say, just anecdotally, in my patient population, where patients have been very successful with weight reduction and treating and addressing their metabolic disorders, those patients still require immunomodulatory therapy. So there is something kind of more going on than just the metabolic disorder driving HS. And we know that HS has a genetic component. Many of the patients that we see in our clinical practice will report a family history and even a hormonal component to their condition. Those of us who take care of this patient population know that all of us have patients who are young and thin and have horrific HS. Even though the kind of classic presentation is an individual who's obese or overweight, that's not the sum total of this patient population. So I'd say there hasn't really been a direct link that's yet described between HS and metabolic disorders insofar as demonstrating a causal relationship. Yes, I think that it's time for us to think about moving biologics upstream, as you say, in the treatment of HS, and to use them sooner than I'd say the average clinician is using these agents in HS patients. But we really need evidence to support. We really need evidence to kind of support that assertion. What I will say is that certainly for patients who have moderate to severe HS, biologics, and specifically the FDA-approved biologics, should be first line for this condition to limit the irreversible permanent tissue destruction that we see in these patients and all the downstream effects that come from that in terms of kind of limited physical function, impaired social and emotional function, and also really to stave off the broader ramifications of having a chronic and irreversible condition in terms of its health system impacts. We know that many of these patients will end up on disability because they're physically unable to work. They also, taking care of this condition in its acute stages really impacts the healthcare system, because these patients end up in acute care services or inpatient, admitted as inpatients in hospitals, and that really stresses the healthcare system. So really thinking about initiating these therapies early and appropriately is going to be key to trying to change the course of HS and limit the irreversible tissue destruction that we see. Yeah, I'd say hopefully my hope is that the biosimilars will improve access to TNF inhibitors for HS patients and make it more possible for more patients who need these therapies to be able to access them. We've seen that the biosimilars of infliximab have done just that. These drugs have been more readily available to patients who need them, particularly patients with HS. And, my hope is that the introduction of these biosimilars will help us really improve the care of this patient population so that they can get these drugs in a timely fashion before we really see the downstream ramifications of HS come into play.